Welcome to the Health Talk Show. And today we are missing Rashmi. She has just had a booster, so she is not among us. But I have a very good panel here to discuss about COVID. Let me introduce myself, Dr. M.S. Kanwar from Indraprastha Apollo Hospital. I deal with pulmonary critical care and sleep medicine. I'm advisor in the department and senior consultant. And I'm also lead in the lung transplant program. And I also lead the COVID program. So we have a very distinguished faculty here with us, Professor Anant Mohan. He is professor and head of the department in the All India Institute of Medical Sciences, New Delhi. And Dr. Om Shrivastav. He's infectious disease consultant at Jaslok Hospital, and also he's visiting professor at the D.Y. Patil Hospital in Mumbai. Dr. Abhijit Duggal, he's the first timer with us. The other two gentlemen have been with us in the webinars and in symposia. But Abhijit, I would want you to be with us in future too. Abhijit is Vice Chair, Department of Critical Care and Director, Critical Care Clinical Research and Associate Professor of Medicine at Cleveland Clinic in the US. So welcome to all of you gentlemen, and we'll be glad to start the program if you're all set.
Yeah. Yes.
All right. The idea of gathering together was to just have an overview, go over the times when this COVID hit us. I mean, it started in Wuhan, and it rapidly spread. And when it was happening in Wuhan, the world was just watching curiously. Never thought it would hit them too. And I remember in the month of January also, we would just read about and see the graphics and what was happening there, and how the people were were quarantined, and the authorities there were very harsh on the people. That's the kind of image we had. But then by March, in fact, by January, it had started hitting Italy, Spain, France, Germany, UK, and then USA. At that time, in the month of March, was it the month of March, when India got the first taste of SARS-CoV-2? Dr. Anant, was it like, when the cases started trickling and the numbers started to grow? And I remember the number was something like 580 only in the entire country when Prime Minister announced the lockdown. Remember those beating of drums and all that stuff that went on at that time. But the number was less than 600 when the entire country was put on lockdown. Well, at that time, what was your impressions at that time, Dr. Anand? Because we all had our different views and visions, and what was happening, was it right or wrong? And only the history was to tell later, what was the right approach at that point in time. Dr. Anand.
Yes, yes. Thank you. Pleasure to be back here on this show. And going back to, this is the February, March of 2020 that you're talking about, that when everything just about started. And I do remember that the first people diagnosed with COVID infection in our country were a couple of students coming from China, and they landed in Kerala. And they were probably the first ones who were diagnosed with COVID, a couple of students. And then, of course, this was a big news then, but nobody anticipated it to take such a huge proportion, such a huge magnitude later. And then the numbers gradually rose. And then in the next couple of weeks, like you said, it was somewhere around 500, 600. This was, I think, 23rd or 22nd of March, if I remember correctly.
Yes,
when our Prime Minister came on the channel, and then he announced a complete lockdown. So you see, at that point of time, it was mostly because of the fear of the unknown. You see, one did not know, and we had already seen the magnitude outside India. Obviously, at that point of time, we were all talking about PPEs. We were talking about masks. Nobody had heard about PPEs. Nobody had heard about N95 masks. Nobody knew what is social distancing. Nobody knew what is hand sanitization. None of us was even aware about all these things, to be honest. I mean, hand sanitation, of course, the healthcare workers, surgeons, they knew, but the general public had absolutely no idea.
Yeah.
So at that time, probably it was there was a lot of panic. How are we going to deal? Suppose this kind of becomes worse. So at that time, I do feel it was the right decision to go for a lockdown. If for nothing else, it's always wiser in hindsight. We can always be wiser in hindsight. But at that point of time, we did not know what we are dealing with. At least that lockdown for 3 weeks or 4 weeks gave us time to prepare, at least prepare some infrastructure, prepare us to handle manufacturing the sanitizers, the PPEs, to try and get our act together in hospitals. A lot of things happened at that point of time. We got our all these SOPs in place. So I think that was right. But then it was the fear of the unknown, and then of course we'll talk about how things unfolded.
Yeah. Dr. Om, by that time, in fact, India had the advantage of knowing what had happened in Italy and Spain, where the mortality had risen up to 14%. In UK, the mortality in those initial days were 10.4%, and Italy about 10%, 14%, and Spain, Spain was 14 and Italy was 14.4% or something like that. Huge. And how the services were overwhelmed there. So India could see what was happening, and the fear, as Dr. Anand said, of going through the same situation themselves when they were not prepared could be taken off guard. So you agree with the decision that was taken at that time to go for lockdown and for prolonged lockdown, which was as long as 3 months?
Yeah. So first up, thank you for inviting me on this platform, Dr. Kanwar. Always a pleasure. I agree with what Dr. Anand said. But if you look back, a little bit behind, the Chinese had already started reporting some mysterious deaths as far back as July, August of 2019. They didn't as yet say that it is coming out of Wuhan. But July, August onwards itself, they had started reporting that there are some unconfirmed reports about some deaths that we don't know what's going on. Then the matter came about the wet markets of Wuhan and the labs of Wuhan. And to give them credit where it is due, I'm not going to go into that part of the controversy. They were also the first people, when they sequenced the entire genomic structure, they were the first to release it in the world. They shared that literature. But as we are all talking about it, none of us were prepared for the situation. Nothing could have prepared us for the situation. And not just us, nobody in the whole world was prepared for the situation. Public health systems all over the world were so overwhelmed that, I've lost count of the total number of horror stories that I've heard about people not getting medical care. Having said that, the kind of recovery that at least India showed, not just in the first wave, but the second wave as well, I would have to say that is remarkable. I've seen nursing staff in PPEs virtually collapsing on the wards after being on their feet for 8 hours and 10 hours and 12 hours and getting ready to come for rounds with me. So yes, I would have to say that we have adapted. And the second wave, howsoever dreadful it was, I think it could have been far worse had Indians not been in that kind of resilient mode.
Yeah, agree with you. Abhijit, you have to unmute yourself.
Unmuted.
Okay. We all recall when New York was hit. In fact, before that, it was Seattle in the state of Washington that the numbers had started growing, and a bit in California too. But it was in New York that the real brunt was felt. So what was the initial reaction in the US hospitals, the doctors, and the preparedness and the public health and the administrators? How did they plan to tackle the situation?
Absolutely. Thanks for inviting me, Dr. Kanwar. What I would say is like what Dr. Shrivastav and Dr. Mohan said, those were exactly the same situations for us here in the US. Like this was something that no one had really prepared for. I think when the initial cases came out from Italy, and then we had the first outbreak in the US in Seattle, one of the things that was done consistently across the nation was that a lot of the hospitals developed what were called incident command centers. And we really kind of preemptively thought about like how things would move forward, but no one was prepared for New York. Like the sheer amount of cases that overwhelmed the healthcare system there was pretty dramatic. In fact, I volunteered to go there. I spent 2 weeks through the height of the first wave of pandemic in New York. I worked at one of the hardest hit areas in Queens, and it was it was almost like battlefield medicine in terms of the sheer number of patients that they saw. What that did was that really changed the mindset for people, and most services that were elective in nature were stopped all across the nation. So all over the U.S., even in states that had not been hit, like, you know, there was voluntary backing off on elective procedures so that they have hospital beds available for individuals. Now, unlike Italy or other places in Europe, unlike India, the one big difference in the US has been that, like, through the different waves, it's never been consistent across different regions. So it has been differential in terms of where it hit. So, like you said, you know, initially it was really New York, and then the second wave really was Texas and California. And then subsequently, like, you know, when the Delta wave came about, like, it was somewhere else. So that's been a little bit different. But other than that, like, everything that Dr. Shrivastav and Dr. Mohan said is exactly the same here too in the US.
We saw here also in India that initially the impact was mostly in those places where there was international connection of the flights. Mumbai first, Delhi immediately thereafter. And the two were the leaders in numbers. And the state of Kerala, as Dr. Anant said earlier, I mean, that was the beginning where the students from abroad, from China, had come. So, but we also saw that differential movement of the virus in different states in India also. But that was probably much more pronounced in the US, as you're saying. I mean, there were some states which were almost spared. I mean, at some point, there was far in so many other states, and then, you know, it was rather a little difficult to explain, because the flights were on, the traffic was on, though probably less, but still there was fire at certain places and relative quiet in others. You know, yeah, this was the case there.
I think one of the factors is, like, you know, unlike India, where, like, you have a national edict of saying, you know what, like, this is what we're going to do as a nation. In the US, because of the federal system, like, you know, states have the ability to really follow or not follow certain public health interventions. And there were states that really did not implement masking rules for a long period of time. And those really became the hubs for latter, like, outbreaks that really happened over the course of, like, 2020 and 21.
And then came the variants in UK, the beta, and the alpha in UK, then beta in South Africa, and then the gamma, or what we call P1, in Brazil. And they all happened within a space of a few weeks of each other. So, Dr. Anant, what was it all anticipated that, you know, there'll be different, mutations happening, and it will take some different direction in the form of variants, and they could all start, you know, in regional areas with smaller numbers and start to spread. And there was so much of uncertainty at that time. What are certain bad mutants? K4179, for example, one of them. And so how would, you know, these regional variants would then, you know, go around the rest of the world and, inflame a new set of pattern of disease? What was the impression at that time when these three variants, sort of UK and the South African and the Brazil, came into picture? That was in the month of January, late December and January of 21.
Correct. So, well, of course, when the virus first came, then it was known and it was expected that mutations will happen and variants will come. because as gradually in 2020, as gradually the understanding of the virus. See, first in the first half of 2020, we were all grappling with the actually the first wave. Everybody, all of us, we none of us really had time to think about anything else. But of course, the basic scientists were going on. They were trying to study the virus, so it was expected. And like any other virus, it was known that mutation will happen, variants will also come. But again, the thing is that in what way they will react, in what way they will impact various parts of the world, whether they will be localized to a particular state or a country or a continent, or they will be these things again preempt, and nobody can preempt. It was only when in certain countries where gene sequencing was being more routinely done, and they had a much more robust system of identification of variants, they were able to identify these variants early, and then they kind of shared it with the WHO and of course the rest of the world. And then they started to look at the clinical profile of those patients who were affected by that variant. So that gave the rest of the people some insight that okay, that particular variant is more harmful, less harmful, the transmissibility index, that is the R index, is high or low. So these were the kind of variant. Maybe there may be other variants as well. How do we know? They may have come and gone within that period of time, which we have probably not detected. They were not designated the variants of interest, or they were not designated the variants of concern, because they did not really fall into that category. And hence, that is why these couple of variants came. They were short-lived probably, or maybe they were overtaken by that Delta wave that came up, that really superseded everything else before that. And then that became another global pandemic that took over.
Yeah, I would come to Dr. Shrivastav. The Delta thing, did we anticipate? It came so suddenly. And since it started in India, so we were not ready for that. And we didn't anticipate the kind of havoc it would play in the initial 4 to 6 weeks. So what was going on in Mumbai, in your area, and I can tell about Delhi, what was happening here.
So I agree. The thing is that there were two things that happened at the time. We were complacent because we thought that the first wave is over. That means COVID is over. And the second thing that happened was, it was bound to happen. The nature of the virus is such that it will keep mutating and keep multiplying in a way until it comes into a plateau. So it is not in the interest of the virus to be lethal for a very long period of time. That is why if you look at Omicron per se, if it is not a dual infection along with Delta or Delta Plus or any other variant, Omicron per se is not considered to be, at this moment at least, it's not considered to be a fatal variant, and it is actually replacing Delta in virtually all the samples that we are seeing in Mumbai. So that is a natural progression of the disease. If you look at all the RNA viruses, whether it is Ebola or Zika or H1N1 as well, if you look at all the small viruses, the lighter viruses, this is how they behave. That is the nature of the revolution. And that we were not prepared out of our own complacency. I think as human beings, we tend to become overconfident once we have won one round and we think that the battle is over. And we have found to our detriment that in doing that, we have allowed so many people to succumb and suffer just because we thought that COVID was over. That is probably the biggest lesson of the second wave, at least where I'm standing in Mumbai.
Yeah. And when we're talking about masks, I'm still surprised why there is still reluctance among public. There has been more reluctance across the globe anyway. There have been people on the streets, against the use of masks and against the use of vaccines and all that. In the US, for example, in other countries too, in UK also. But in India also, there has been reluctance to use masks, despite the fact that there was a havoc that was being played during the COVID, the Delta times. And we were overwhelmed with in services. I remember, there was no bed available in entire Delhi and NCR. And the patients were still lined up for video consultations and all that. And we had to send them to nearby cities like smaller places, Rewari, Hisar, Chandigarh, Ambala, Meerut, what have you. Wherever you get a bed, just grab it. At least you will get oxygen. That was the idea. So at least somebody will be monitoring you, even if they don't have the facilities of ventilator. At least up to that point, you could be helped. So that was the state of affair in Delhi. There was no bed available for some time, and in my hospital, a point reached that we had a waiting list of 1,000 patients. I mean, that went on for a few days. You can just imagine. Abhijit, did you have similar situation? Because in USA, it has dragged on and on. In fact, USA has never been too quiet. In India has quietened down. UK had quietened down. Italy, Spain, Germany, France had quietened down. But USA, it was simmering all the time. It is a big country, spread out country. So different states had their ups and downs at different times, as you already said. But it had gone on and on. So how has the country coped up with this, which would have been a fatigue by now for over 2 years now?
I think there is fatigue, like especially amongst the healthcare workers. I think like this has been a non-stop onslaught. Like, you know, unlike other places, like you said, we've not had much of a respite from this. Like this has been an ongoing thing. Like so beginning of 2021, like, you know, as the vaccinations happened, like, you know, there was hope. There was hope that, you know what, we'll be able to have mass vaccination amongst population, given the fact that there is availability of vaccines for most of the country. But then vaccine hesitancy, I think, became a very big thing. And with that, like you already mentioned, that, you know, this aspect of the, you know, not believing in science and not masking, not being willing to vaccinate yourselves became a very, very big aspect. Like Dr. Shrivastav said, you know, I think there was complacency. There was complacency that, you know, this is just going to go away by itself. So in the US, beginning of 2021, it was mostly alpha that we were grappling with. It was smoldering, like we were consistently seeing people. But right around April, May is where Delta really took over. And then when Delta came about, it just overwhelmed the healthcare system all across the nation. And just like you were talking about, like, you know, we were facing similar situations, hospital beds were full. The sickness level was so much higher. So we are a very large ECMO center that feeds close to about like a population of 6 million people. And we and every other ECMO center were running at 100% capacity nonstop for months on end. And this continued till almost the end of December here, that like for those 7-8 months, Delta was the predominant variant in the US, overwhelming the healthcare system progressively as time went along.
Yeah, that's right. Yeah. We also saw that the symptoms of the virus had changed a little bit from the first wave into the second wave and now Omicron. So the symptoms have changed over time. This actually, even before the variants were sequenced, and the UK labs were the ones who were the leaders telling the rest of the world, you know, what was happening. We even before that, we thought that something was happening with mutations, because why should the symptoms all of a sudden, not all of a sudden, over a matter of week or 2 or 3 weeks, start to change? Dr. Anant, I mean, did you notice that during the first wave and later, you know, in the later months and towards September, October of 2020, that some symptom complex were changing? And that gave us the suspicion that probably some mutations are happening in the virus and the character is changing. Dr. Anand?
Yes, that's right. So for those who had been consistently following up patients or seeing patients throughout, would definitely note a slight change in the clinical profile as time goes around. So in 2020, it was the traditional symptoms of the first wave were fever. Then there was, of course, cough was there, some shortness of breath. It was the loss of taste and smell also was there. Some GI symptoms, mild GI fatigue, of course, was there. So these were going on, and they were, you know, and many times atypical symptoms were also being seen. Then they lingered on, of course, but in the second wave, that is during the Delta wave, probably we saw more of pneumonic symptoms, So it was more of low respiratory involvement, it was more of the hypoxemia and hypoxia. The greater proportion of patients were falling into the moderate to severe category, where they were hypoxemic and required oxygen and further treatment. That is why the sudden demand for oxygen, steroids, remdesivir, etc. And the situation our country was in during the 2 months of April, May. So that was a kind of maybe changing profile of more severe in the Delta wave. And subsequently, of course, that is also that persisted till about, say, maybe June, July, even August maybe. And then from there on, as the number of cases have reduced, then of course the now the clinical symptoms that we are getting of Omicron are again slightly of the less severe variety. They are presenting more of upper respiratory symptoms, less with the lower respiratory and the pneumonic symptoms, mostly by the fever, the coughs, sore throats, dry coughs are there. And we are not seeing too much of those loss of taste and smell that we were seeing earlier. Whatever I have seen, at least I have not seen, but I like to know the opinion of others also. Maybe rarely, yeah. And some GI symptoms are still there as the presenting feature, again in a minority, but majority remain upper respiratory symptoms, and relatively smaller percentage go on to develop symptoms which require any hospitalization or oxygen.
Yeah. In Omicron now, what we are seeing is just low-grade fever, a little itchy throat, and a little bit of sinus issues, a little bit of nasal stuffiness, mild cough, and some complain of headache, a few complain of body aches or backache, and also we have some cases with diarrhea and a few cases with vomiting. In fact, today only I saw 3 or 4 cases of diarrhea or vomiting. Dr. Om, do you agree with that, or you have a little different pattern there in Mumbai?
You're quite right. You're quite right. The thing that I'm seeing most commonly now in the Omicron variant is that people, even if they are asymptomatic, and I'm talking about people who are very fit, people who run about 8 to 12 kilometers every day, they seem to say, look, I went into operating theaters this morning at 8 o'clock, 8:15, I had to come out because I just couldn't stand. I couldn't take the weight of my legs. And there is a backache, which is crippling. There is also this exhaustion that lasts for anywhere from 1 to 3 weeks' time. So that is probably one of the features when you say, are you probably dealing with Omicron? Having said that, based on features, it's very difficult to say that it is one variant or the other. As you and both Dr. Anant were rightly pointing out, that there is no loss of taste, there's no loss of smell, there's no symptom that you will say that yes, if you've got this, 100% we must test you for Omicron. So that is the other thing that we are learning. It's our clinical evolution as well. We are learning each day as we see new patients. I'm sure all the speakers will agree with me that we didn't know that COVID-19 will be a vasculopath. The number of people who've got deep vein thrombosis or pulmonary embolism or aortic aneurysms or mesenteric artery thrombosis or even strokes, cerebrovascular thrombosis, that number just kept climbing. And it's only after we read more and found out that there is a vasculopathy, the arteries are involved in such a way that it can be involved even after patients have recovered from COVID, 8, 9, 10 months after they have recovered. So it's been a process where we have all learned as we have seen each new patient every day. But I think that this is ongoing. It's not going to stop for a little while. And we must be aware and keep our eyes and ears open.
Yeah. And Abhijit, we were talking about, like Dr. Om was hinting about the long COVID. We had terrible long COVID cases in the first wave and also in the second wave. And hopefully it will not be the case in the Omicron wave, the third wave. So far, the patients are not really complaining much about too much of weakness, tiredness, fatigue. It has been there for the first 2, 3, 4 days, and then it peters out. So what has been your case? Because you're still dealing with, though in USA, Omicron has overtaken Delta. but you still have presence of Delta. So what has been your experience there with the long COVID situation?
I think long COVID is a reality that all of us are really facing. I think those of us who work in the intensive care unit settings started recognizing, that there is a post ICU syndrome that exists in most patients. But I think with just the sheer number that we have seen associated with COVID, it's been amazing in terms of how many people are suffering from long-standing disease processes. Like Dr. Shrivastav said, the vasculopathy associated with the lung injury really can be debilitating for a lot of these patients. Like you said, Omicron's relatively new here, but it's completely changed the overall infectivity aspect of things. Like till middle of December, we were about 70% Delta, and in the last 4 weeks, it's become 100% Omicron in the US too. Like all the new samples are basically positive for Omicron. Still very early times, like everyone said, the symptoms seem to be much milder, but is it going to be associated with some long-standing issues? We don't know. I think we need to give it some more time to really answer that question correctly.
I agree with you. Dr. Om, coming back to you, this Omishore kit by Tata Medical and Diagnostic, have you heard about that, or have you? It's not yet in the market, but it's supposed to be in a day or so, or probably already there.
I think
is
today.
Supposed to pick, today, which is supposed to pick Omicron. So how gung-ho are you about that?
Well, not very, unfortunately. I'm a little hesitant about, recognizing new technology as being the next wonderful thing after white bread, and disregarding old technology because we think that something brand new has come. I would like to see this kind of technology stand the test of time. I'm sure in principle, in theory, it probably is very good. It is very good. I have no doubt about that. But it has to be validated for patient accuracy and patient comfort. Until that happens, it is still only a kit that's got a lot of promise.
Yeah, that's right. I agree with you. Yeah. Dr. Anant, now let's talk a little bit about the boosters, and what kind of boosters do you have in mind to recommend to people when they ask you? They keep asking you, and they want to know. I have had Covishield first and the second. Which one should I have now? Should I have Covaxin? In fact, India has the luxury of having so many vaccines at the moment: Covishield, Covaxin, and we had Sputnik, we had even Moderna theoretically is there, J&J is there, Zydus Cadila is come up, so it's not yet in the market. Novavax, and the two new vaccines which have been given approvals just about a week ago is Covovax and Covax and Corbevax. So we have the luxury of so many vaccines, but when people ask you, which one should I have? I've had two Covishields, which one should I have? So what is your automatic reply, Dr. Anand?
Well, my automatic reply is, that as of now, the recommendations are to take whatever you have taken before. So if one is already vaccinated with a particular vaccine, then the recommendation is to take the same one. Now, because you see, apart from the Covaxin, Sputnik, and the Covishield, none of the other vaccines that you talked about have actually been used in the mass immunization vaccination program of the country. So, and many of them are not actually in the market even as of now. They have just got approvals. They are in the manufacturing stage.
Yes.
The ones that we actually have are the Covaxin, Covishield, and the Sputnik, actually, that all of which have been used in large numbers. So again, of course, there is a case and things may evolve because a lot of data from across the world has looked at mixing the vaccines, taking a different vaccine for a booster, and they have given their various reasons for doing so, scientific reasons, of course. So things may change, but I think as of now, the recommendation does remain that take the same vaccine as the booster, which you have taken earlier as part of your actual vaccination. So I this is still in progress. You may get different tomorrow, but this is what even I have to recommend, because I have no reason to say anything different. I have no backing to say anything different, because there has to be some scientific justification from our own country too.
Yeah. Okay. There have been conflicting data on that too. That's why, I mean, one wants to play safe. Dr. Om, what is your view on that?
Oh, well, you're going to put me into a spot, aren't you, Dr. Kanwar? Yes?
I want to know your opinion.
Look, I agree in principle with all the speakers that we need to follow what is policy of the country, right? The policy of the country has been written with a lot of intent and a lot of effort, and probably with the best amount of information available at this time. Having said that, a number of places all over the world are using combination vaccines. If you look at vaccines, if you look at the influenza vaccine or the trivalent vaccine or the quadrivalent vaccine, in fact, the pentavalent vaccine is around the corner. So all these vaccines are going to be combining more than one molecule that's going to be working in more than one way. And you look at the kind of benefit that influenza has, or H1N1 has, or any of these viruses, when you give this vaccine, they're not mononuclear vaccines. They're polyvalent. They're vaccines that will work in more than one mechanism, in more than one direction, and offer protection to the patient in more than one way. So I think there is some merit in keeping our eyes and ears open and having an open mind. I don't think we should shut down the possibility of having a combination vaccine in the very near future. But why not let us wait and see what global literature says? But I'll come back to the point I was making. If it is the policy of the country, there's a lot of effort that has gone behind it by men who are wiser and smarter than at least me. So I will be obliged to follow what they have written out at this time.
All right. Well said. And Abhijit, in US, what is the policy there?
So in the US, the vast majority of people had received the mRNA vaccines. So the booster dosages are mostly being given for that. People who had received the AstraZeneca one, because it was just one dose, they've recommended that you can mix and match and then use the mRNA vaccines as your booster dose. So at this point of time, most of the individuals are either getting the Pfizer or the Moderna as their booster shots. That's been the consistent thing in the US.
All right. We have a few minutes more. What do you see as the future of COVID, Dr. Anand, from where we are today? We are still probably looking at the highest numbers in the world that have ever happened in a single day of new cases, though with a milder variant. But how do you see? We probably are optimistic, and we want to think that the natural kind of variation that had to happen in original SARS-CoV-2 in the form of a milder variant, which could be very transmissible but not very virulent, like Omicron right now. And it probably would pave the way for a more generalized immunity and probably help save the world from more variants in future, which are still happening. They're going on and on. Mutations are going on and on all the time. But if there is something more virulent on the way, then probably by the time that hits, Omicron might have given immunity to a large part of the world. So how do you think about that?
So it's difficult to make accurate predictions. Of course, one can never make any accurate predictions of this kind. All those people who have tried to do so, I think, have failed, because
certainly not with COVID. Certainly not with COVID. Yeah. Everybody has failed.
Correct. So, but yes, I think scientifically it does stand to reason, and we hope it will happen. That because you see, when the Delta wave had struck, still the vaccination had just about started, and hardly anybody was fully vaccinated at that point of time. We can only hope now, as you said, that the Omicron, which is the relatively milder form, and the numbers are huge, it is going to affect a large part of the country and of course the world as well. In a way, if you look at the so-called brighter side, it may actually boost up the immune system, and it may, along with the vaccination, it may allow majority of the globe actually to get relatively good immunity against any future so-called attacks against the virus, which may even be more virulent. Yeah, I agree. So one can never predict. One can also never say that any vaccine will be protective against every type of mutant or variant, because one doesn't know. But one can only hope that it will at least protect adequately against progressing to a severe disease, if not infection per se. So if that happens, vaccination plus the current relatively milder Omicron together, maybe if in the next couple of months are able to cover majority of the population, we do hope that even if some further mutations occur, even if they are not so mild, we should be able to, and we hope that we'll be able to tackle them with our immune levels. I don't know what will happen regarding the vaccine part. I am not sure whether the vaccine may ultimately become an annual vaccine. Who knows, that may happen. At least for the next few years, it might happen actually. I don't know about the long term. So all these things, one will just have to wait and see how things. I'm even thinking maybe, who knows, one may combine the influenza and the corona vaccine into one. Who knows, that may become a consolidated annual vaccine in future. So all kinds of things are possible. But right now, our goal is to kind of safeguard the population by vaccination or by natural immunity.
I agree with you. Dr. Om, what's your take on that, please?
So to a large extent, yes, I agree. Let me share with you my two big concerns with the Omicron variant, okay? When we first got to know about it, it had 32 mutations on the spike protein and about 10, 12 mutations on the receptor binding domain, RBD. The French variant, which is not yet a variant of concern, that got described about five or 6 days ago, that has got 46 mutations on the amino acids. All of them are in the area of the spike protein. So what is the point? The point is, most of the vaccines that we have given en masse, at least in India, are mRNA. They're not mRNA per se, but they're at least vector, they're vector covered mRNA vaccines. I wonder whether the virus is preparing itself to go to the next level, or is it going to stop where it is and say, look, I've had a run of 3 years, and now you can live with this for the rest of your normal biological life. So I'd have to think that vaccinations will probably be furiously corrected, recalibrated, remade over the next decade time, maybe 2 decades time. And that it is something which is a work in progress, but it is a contest. We are nowhere close to the intelligence of the virus, and that we will need to be ahead of the curve if we are going to vaccinate the most vulnerable part of the whole globe and keep them away from infections. But we are not there yet.
Yeah, I agree with you. The virus will have to run it will have to run out of steam. It's not that we are going to catch up with it. And even if we tweak the vaccines, and we'll have to keep tweaking the vaccines, as you said, it will only be giving, by the time the mass vaccination is done with the tweaked vaccine, that virus is already out of the picture. So some newer variants are already trying to build up their case. But anyway, I agree with that. Tweaking of the vaccines is absolutely essential, and probably is going to be an annual thing, as Dr. Anant has said. And it is also possible that eventually it will be mixed with influenza and probably H1N1 vaccines. So that would probably be the case in future. Abhi, what is your take on that?
I agree with everything that's been said. I think this is going to be a reality. I think the issue is even if we get the vast majority of our population infected with Omicron as time goes by, we really just don't know what the immunity would be like 3 months, 6 months down the line. Like we know that natural immunity was not very protective for the earlier variants. So I think that's always a concern. So immunization is going to be our best bet. I think global immunization in today's day and age, it should be the goal. I think, if we feel that we can have isolated pockets in the world, immunize, and perhaps we'll save ourselves, that's not going to be like the right thing to do in today's day and time. Like if we have large pockets in the world that are unvaccinated, the risk of new mutations and propagation is always going to stay.
That is what has been the question about the vaccine equity, which Tedros of WHO has been talking about, repeatedly, that vaccine, unless there is a vaccine equity and it's given all over the world to all populations, we will not be safe, wherever we be. So, well, I think we have had a fantastic discussion today. We went over the past, a bit of present, and we are talking about the future also. Thank you so much, gentlemen. It was a very interesting, pleasurable discussion on a very bad run of time that this virus has given to us. It has changed our lives, in fact, changed the world. It's changed the way the people looked at their future, the way the economies looked at their future, and it has destabilized the economies in fact, lots of companies have just gone bankrupt. Cruise industry has gone bankrupt. The hotel industry, the airlines, and the tourism, and of course, there are so many other effects everywhere. But well, the world is trying to grapple and trying to live with new realities. And hopefully, the Indian economy is still picking up. In some way or the other. Some numbers are surprisingly good, and hopefully, we always try to look for a better future, and hoping that eventually the virus would have run its course. If it's not done it, it would do it very soon, and will start to live normally all over again. Thank you so much, Dr. Anant, Dr. Om, Dr. Abhijit. Thank you very much for your time and your expertise. Thank you.
Thank you.
Good night.
Thank you so much.
Thank you.
Thank you.